Hello. The COVID-19
Hello.
pandemic means that many of us are staying at home and doing less in terms of social interaction and exercise. This can have a negative impact or negative effect on our physical and mental health. Hello, my name is Dawda. I'll be your co-host today, and I have Ebrima, who's also next to me, who's the founding father of HealthStar. And today we will be discussing about how to stay healthy during this pandemic period. Hello, Ibrahim.
Hello, Dawda, and thank you very much for co-hosting this video series on HealthStar's page on Facebook. Like you said, today we are going to talk about how to stay healthy during the coronavirus pandemic, because we are staying most of the time at home, and I understand that is not usual for most of us. So we are also going to talk about some key points that you have to maintain to stay healthy during these difficult circumstances, which I hope will go by very soon.
Sure. So our discussion today will focus on 4 to 5 key points. We will discuss staying physically active, looking after our mental health, quitting tobacco, healthy parenting, of course, which is very important as well during this time as we all stay in home. And also we will then dive into eating healthy as well. So if I go on to the first topic, as we are going to discuss today, staying physically active. We all know how physical exercise and is vital for our physical and mental well-being at the same time. And what are your thoughts, Ibrahim, regarding that?
Yeah, Dawda, I think it is really important to stay physically fit during this lockdown. And I think Gambians just need some form of reminding, because they've been doing it. Because I've seen a very interesting game on social media where people will be posting photos of themselves making these push-ups. And I think it was something really wonderful and commendable, that the people were not just staying physically fit, but mentally sound as well.
Yeah.
Because people had fun with these online videos. And I think, Dawda, you also participated in it.
I did.
Yeah, you did.
One.
Yeah, although I did not participate because I am probably very afraid to share my push-ups, but I think I would have also.
Because you're very good at push-ups, I guess. You're very good at push-ups.
Yeah, so I think
it is very important, to be physically active during this period, and I was very glad that, even some celebrities and politicians get involved in it. I saw Mukanda's video.
Yeah, for something that started in a little country like Gambia, with a population of just 2 million or about 2 million people, we've seen countries like Uganda where the President Museveni had to even, do the same push-ups. That was initiated by people in the Gambia. And then I saw this story on BBC. It was making the headlines. So I think, like I said earlier, Gambians just need some form of reminding, but they've been definitely staying physically fit. So just to encourage them to do more exercise, because during this pandemic you'll be eating a lot probably, and you need exercise to stay physically fit. But we are also going to talk about later the mental aspect of it. It is not just a physical. Right now, it is not just our physical being assigned to one place, like the compound where we are not allowed to go out and just do the usual activities we do. But this has a very serious psychological effect, which we are going to talk about later. But to stay physically fit is very important, and what you can do is like one form of physical exercise is these push-ups. And the second form is, I don't know how it is in the Gambia right now, but if you are allowed to go on a jogging, you can jog for like 30 minutes around your home, or you go to the football field, because we don't have most of these facilities that are available in Europe and America. I think you can just go to the football field and jog on an open space, because it is important to do these things or this exercise in an open space, avoid cross-infection and all that. Because right now I understand that all the gyms are closed, and you cannot go to the gym to do some form of physical exercise. But physical exercise could be done at home, and we encourage our elders, the elderly people in the Gambia, who normally go for, before the corona, they go for these Fajr prayers. So as early as that time, they can take a walk in the compound. They can be walking for like 10, 15, 20 minutes. This is very important just to get your blood circulating, and and it's very interesting to do this physical.
That's very important that you mentioned that, because when we talk about physical exercise, we talk, we always talk about, the exact one, like, putting more force into it, or the aerobic one, and all those things.
Yeah.
But
yeah.
sometimes, making sure that you have 3 to 5 minutes a day of exercise is very important, especially for elderly people, because we should know that even with COVID-19, there are some COVID, like some, disease conditions that are already within our system. Because most of it, like in Gambia, we have, there's a prevalence of hypertension, diabetes, and all these diseases. It is important that people try and understand the benefit of exercise, even for 3 to 5 minutes, just to walk around the compound and all those things. Try to make a little bit of like squat or stretching, in order to try and make sure that there is, a good blood flow into our system. And in this way, this can reduce. We can even prevent us from having blood clots. We can cause stroke.
Exactly.
Yeah.
So I think physical exercise, there are a lot of things that you can do to keep yourself physically active. And then it doesn't just have to be running. It doesn't just have to be push-ups. You can do exercise by simply walking. You can do exercise by simply helping your wife as a man. So these are all things that you can do, because we saw the other time journalist Farmer Fofana helping the wife, and he posted it on Facebook, which was really wonderful and amazing. I think during this period we are physically distanced, but we could be emotionally connected as individuals.
That's very cool. Okay, but I'm going, okay. We spoke about the importance of physical exercise, or being active, should we put it? Because when you say physical exercise, it can drive a lot of people away, especially the elderly. Exactly. And the focus here, I believe, is for the elderly people who probably would not have that, the means to go out and do for a run and all those things, or does not feel safe to go out. They can put on those clothes or something like that in order to go for a run. But if you look at the other activities, that can, especially the ones that can increase the lung capacity, it is very important, because there have been research done in it about the effect of physical activity in terms of increasing lung capacity in order to improve your tidal volume, which is how much oxygen or how much air you breathing in, and this helps in your respiration as well. And as COVID-19 is affecting your respiratory listening, it's very important that we do put these things into consideration and try and increase our lung capacity in order to be able to fight this virus if the time comes as well. So
yes, so I don't think there's any form of word or something that we can use to describe how important physical exercise is during this lockdown. So we're just going to encourage Gambians to keep up the exercise that they have been doing, and those that are not doing exercise to start exercising, because it is really important, not just for coronavirus, but other diseases as well that are already prevalent in the Gambia.
Good. So
now, Dawda, I think we can move into the next point of discussion, which is going to talk about keeping yourself mentally stable during this pandemic, or looking after your mental health during this pandemic. So mental health is your area. I am going to allow you to tell us your thoughts on how to keep oneself mentally stable.
Oh, being mentally stable, or trying to keep yourself mentally keep your mental health intact during this period is very important, because we should understand this is not a norm for everyone, for all of us. And what happens is that a lot of us did not spend this amount of time at home as we do it now. As much as some of us are finding it difficult sometimes at work, but we do not want to sit at home and this all the time at one place. So this can have a big impact in our mental capacity, especially the fact that we do not plan for it. It's not like it's a retirement phase whereby you are going to retire, so you're going to stay home. But in this case, it is something that just comes like that abruptly, and then you are asked to stay home. So by doing that, mentally your body is trying to tell you that this is not you. This is not you. You're supposed to. This is not what you normally do. So it is important to try and keep yourself focused, every day, to try and create some task for yourself at home, to keep your mind engaged. And also, if you're living with people, it's very important that, you try and find some social cohesion as well, and then we try and understand each other. This is the period whereby we should make sure that we understand each other as individuals also, but at the same time as family and community.
Yeah, Dawda, just to dwell into that point, I think it is very important that you mentioned during this period, people are staying at homes, and we know how congested most of the time our Gambian homes are, because in one household you can find 10, 15 people most of the time in the Gambia. And then when everybody is staying at home, there may be problems with quarrels. Do you think this can affect our mental illness? Because I understand that these quarrels and problems amongst ourselves, especially when nobody's going to work, we are all staying at home. Many a times, I think the problems or these quarrels would increase. So I don't know if that's have a negative impact on probably on our mental health as well.
It is. It is very, because because we are not used to spending so much time with each other. We kind of avoid each other sometimes. But now that we're spending so much time together, we find that we try to find every negative bit, any negative thing about someone else, and we talk about it. We try to pick them up. So in this way, without even realizing that we are upsetting another person. So looking after your mental health, can only come into effective, if you look after somebody else's mental health. So we have to understand that, it's very easy to trip over each other during this time. So when you are with someone, you just have to be mindful that sometimes, they might be over the edge, that, they are not maybe coping like they are showing physically. So when they say certain things, they might not mean it. So it is very important whenever there is like a quarrel, we try and step back, think about it. We try and de-escalate the situation and come back to it again and discuss it together and says, how do you think that went on? Where, I think I've done this wrong. I should not have jumped to the conclusion in this way, but you should not have done this way as well. So in that way, we are working together, and then we are helping each other as well, because
and to live harmoniously as a family and one unit, because the coronavirus is just temporal. It is not going to stay forever. Coronavirus too will pass. So we just have to understand that this is temporal. It's not going to last forever, and that we need to live harmoniously to make our stay even more at least comfortable, because it is already uncomfortable. But if we stay happily together, we could be doing so many things together to have fun as a family unit. So the other thing I think is to play games among each other. It could be Ludo, it could be Marias, it could be any form of games we have in the Gambia, you name them. You could be playing these things together. And the other advice that many people will be giving is to be watching TV, but people must be careful, because you cannot spend too much time watching TV. It may have a negative impact on your eyes and all that. So you should be having intervals, between, because I know some people who be watching the TV from morning till evening or night, and this may also be harmful to their eyes, and because they are focusing
even on your mental state. Because what happens is that what you focus on is what you become. It is that simple. If you focus on TV, especially at this time, and whereby everything on the news is about the virus, so some people, we have to realize that not everyone is mentally capable at this point. There are people who have pre-existing conditions, like they are, some of them are having some anxiety problems, but it's not showing up. So when this information is up, it's just like even WhatsApp. That's why I always tell people, before you post something or before you share something, think about who is on the other side. You never know, because you might have someone else who's suffering from some anxiety or depression or something like that. You keep sharing these things to them, you are making their situation worse, even though they are not coming out to tell you that this is making their situation worse. They will not even probably realize it. But all they see
just on the same point, I think then this becomes the responsibility of every social media user, to clear out any misconceptions that are on Gambian social media, because you will understand that many a times there are a lot of misconceptions about this virus or any other thing. So it becomes the sole responsibility of any social media user in Gambia to clear out any misconceptions, because we'll be seeing a lot of misconceptions, misinformations about coronavirus that are being shared. And then misconceptions and misinformations during a pandemic are very, very dangerous because they stick. When people get to believe in something, it is always very difficult to change their mindset. You can ask epidemiologists who try to do behavioral change communication to talk to people about changing behavior. It's always difficult to change the behavior of a people. So this is why it is important to send the right and the factual information at a time. But because it is easy to just buy credit and post anything you want on Facebook or any other social media, but this is going to have a negative impact on the people, because you know that what you are posting is not true. So I think if I am you or any other person who is using Facebook and you know that this is not true, we should rectify those people as soon as possible. And I think the other things that we can do to make sure that we are mentally safe during this period is to also use the time we have to commend our frontline health workers, like it is done in other countries, like in the countries where the coronavirus is very deadly, like the US, the UK. We've seen how much time these people spend actually thanking those who are sacrificing, risking their life to make sure that they are fighting this coronavirus. So I think during this period, we can use it to thank the nurses, the doctors, and the public health officials, and everybody who is making sure that coronavirus becomes a thing of the past in the Gambia. We should spend this time to thank them really. And I've also seen the efforts of philanthropists, youth groups, individuals, in donating food items during this pandemic, which is definitely Gambian. I think that is typically Gambian. That is what defines us as Gambian people, because we are one as a nation, and it has been manifested during this coronavirus, how united the people are to fight this virus, to make sure that people who are underprivileged are given the necessary things they need to survive during this pandemic, which is definitely commendable, and we want to thank them really as health stars.
It's very, it is very important, because trying to be there for each other also help everyone. In this case, if you helping somebody who is in need, you are in turn helping yourself of your own mental state. Because if you are doing this in your heart, it is helping you with your mental state as well, because it is helping you, this makes you happy, it increases your endorphins and your dopamines and all those things, which boosts your immunity and all these things, So these are all good. If your immunity is boosted, it means that, you stand at a fighting chance as well. So in turn, we are helping each other, by doing all these things.
You're absolutely right, because you talk about immunity, and then I think immunity has a very significant relationship with stress. So it is important to distress yourself, and then some of the things that we already mentioned are some ways in which you can reduce stress and anxiety levels. And you can try and reduce your stress and anxiety levels as much as possible to make sure that you stay healthy, because if you are stressed, you are going to in turn decrease your immunity and make it very easier for any other infection to attack you, not just coronavirus. So I think our health is part of health, like the definition of health includes mental health, because it is not just the absence of disease, but also includes our mental
state of mind. State of mind, it's very important as well. So that brings us to our next topic that we are going to discuss, because we spoke about immunity. So now we're going to dive into a topic which sometimes can be controversial, but a lot of people understand, but they still do it in any way, even though it reduces our immunity. Everyone is, I used to smoke anyway, but then you tend to realize, how bad it is for your health.
I didn't even know that you used to smoke now.
I did. I used to, but then when you realize, how much, if you, so the topic here is about quitting tobacco or quitting smoking. But then what you know is that, you notice is that, if you smoke and you do physical exercise at the same time, when you stop smoking, after a period of time, you realize by yourself, how much your lung capacity increases, the physical exertion reduce, and then the distance or miles that you cover a certain period of time also increases at the same time. So this is something that, you know, it doesn't need a big scientific point of view, but as individuals, we can all think about this, you know. But when we now dive into something that people do not understand about smoking and how it's related to hypertension, cholesterol, diabetes, cancer, I wanted to give them a little bit of thought so that they can have some understanding.
Yeah. Yeah, so Dawda, I think smoking has some significant relationship with all these diseases you mentioned. And then most of the people smoking, they know clearly well that smoking is harmful for their body. But during this pandemic, why is even smoking more dangerous? It's not just the decreasing your immunity part, but then once you smoke every maybe 10, 15 minutes, you would be having contact with your nose, your mouth, and your eyes because you are smoking. So you will be increasing your chances of even contracting this coronavirus, because one of the key things to avoid is not to be touching your face with your hand. That is one of the key advice that is given by WHO. So as a smoker, you would be touching your face every almost 10, 15 minutes.
And you shouldn't be sharing smokes. You shouldn't be sharing cigarettes, I believe, which is something that's a no-no around this. You know, smokers like to share.
So I think, yeah, it happens in the Gambia, but then the people who likes to share more is the cannabis smokers in the Gambia. I think one joint could be smoked by 15, 20 people. So
this is not the time to do that. You know, we should remind them that this is not the time to share. You know.
Yeah, so I am not there to judge you not to smoking cannabis or marijuana as people mainly know it. But then even if you smoke, then smoke alone and not to be sharing your smoke right now. Those people who drink attire also, I think we will not just focus on those who smoke, but people who drink attire also, they should avoid sharing cups. This attire green tea cups, they should avoid sharing them.
Important, and yeah. That's a good point. I didn't thought of that, but that's a good point as well.
Yeah, so because most of the time when I was in the Gambia, whenever I was organizing a program talking about smoking, the smokers would always tell me that why don't you also talk about those that drink attire, which is almost like the same, you understand, when it comes to sharing of cigarettes or sharing of, although smoking is way more dangerous than drinking attire, but we will also advise those that drink attire right now, especially in the ghettos or attire booths, let them avoid sharing this green tea cups. But then smoking, if you are a smoker, think of quitting now. And then you cannot just quit smoking like that, but you can minimize the number of smokes you smoke. Yeah. Exactly. And then try to distract yourself. Anytime you want to smoke, distract yourself, do something. Within 2-3 days, your urge to smoke will go, because it is the nicotine that is making you want to smoke again. But at some point, the urge goes away.
So I think sometimes you advise some people is to try and find an alternative habit that is more of a, you know, a healthy habit. Like for example,
because it's unfortunate that in the Gambia you cannot give people this nicotine gums, but they are not available in Gambia. But in the West or the developed world, you can have this nicotine gums, because it is just like taking one smoke. Like if you chew a gum, it is like you already smoke one joint or one cigarette stick. So, but unfortunately, these things are not available in the Gambia. What you can do is start minimizing. If you used to smoke 10 cigarettes a day, minimize it to 5 or 4. And then as time goes
on the Ramadan, we are in the month of Ramadan now. So people can capitalize on the Ramadan and try and reduce that as well. And reduce that, you know, and also sometimes what you do is to create a different urge. Like you can have a bottle of water. Anytime you feel like you need to smoke cigarette, grab a bottle of water and drink. You know, it might sound something simple, but if you create that, because I remember at the time, I know somebody else before all this nicotine, he started with a nicotine one that has some light on it. So what he does is that, you know, he has these beads. It's like beads in his hand when he's in his car, because whenever he's driving on a long journey, he just wants to smoke.
Yeah.
So, but now what he does that there's these beads he have in his hand. Whenever he has the urge, he get hold of that beads and he starts just playing with it in his hand. And that, because the mind is now altered, you are now thinking of something else, you are concentrating on something else, and all of a sudden the urge to smoke goes away a bit by bit. And it does help. It's very hard to quit at the beginning, but if you say to yourself, I've been smoking all my life and I can, it just means that, you know, you are just giving up.
It's just about putting in effort. It's just about putting in effort. Yeah, it's important. I think smoking has its own devastating effects, not just contracting coronavirus or during this pandemic, anybody smoking should think of how to quit, because it is harmful to your lungs. Even if you contract the coronavirus disease, you are 2 times at risk of developing complications because your lung capacity already diminished. So it's
exactly. So to put it in a scientific context, we know that when you smoke, what happens for a certain period of time is that your alveoli, especially the one at the base of your lungs, will start to collapse. And when they collapse, means that they are not inflating to certain points. So this is impacting gases exchange. When you say gases exchange, we mean the amount of oxygen going into your blood, and this can make you hypoxic as well. So it's going to affect you, especially in the time of this virus. If you happen to get the virus, you are more susceptible to have a severe condition or to even die from it. So it is very important to have this at the back of your mind. Every time you're having a smoke, you are putting yourself at risk. So that can also help some people.
I think, but then, like I said, most of the people smoking already know, because it is clearly written on the cigarette packet that smoking kills, and some horrible pictures are also put in place. But then, nevertheless, the people still smoke. But then, if you're a smoker, like the only advice we can give you is to quit smoking. It is putting you more at risk of developing coronavirus, and putting you more at risk of developing complications once you have the coronavirus. So from the health staff and from any other medical practitioner, we are telling you to quit smoking, or think of at least make some effort, at least for the sake of this pandemic. And like Dawda put it, it is easier for us right now, those that are Muslims and are in Gambia, who are fasting during the holy month of Ramadan. It could be a very good opportunity for you to quit smoking. So, Dawda, I think the next point is about healthy parenting. Unfortunately, I've not been lucky enough to have kids, but then I know that you are married and you have a few kids, so probably you could start off and tell us your thoughts on how to be a very good parent or a father during this pandemic.
I wouldn't say that I'll be the best person to advise, but however, I know one or two things there, which I can relate to, even though most of the time I am at work, so it's my wife who's looking after the kids every day at home, going through the homeschooling, trying to go through the homeworks that they send to them every day. So to put this in terms of in Gambian context, they are not getting that pressure as well, but they have the responsibility to make sure that the kids are active. The first things first is, like in here, we start by making sure that, kids are active. They wake up in the morning, we get them into the same routine. We try and make sure that they keep to the routine, because at the end of the day, at any point of given time, they will go back to school again. So, and you don't want them to go out of that routine system. So in the morning, you start from a little bit of exercise. We play some YouTube videos whereby, we have some routine exercise for about 30 minutes, or 20 minutes, as long as they can keep focus during that time to do some stretches or have some activities, and then you go on to do their work and make sure that they do some of their homeworks. And in the Gambia, because the Ministry of Education are putting this online education or radio educations out there as well, you make sure that they follow this routine, they do their assignments as well. It is very important to keep their mental states, to make sure that they have enough break as well in between.
Absolutely, Dawda. You're absolutely right. And I think looking at our Gambian settings, you will realize that there are some lazy adults in the Gambia, who would capitalize on this pandemic not to do anything, and would want everything to be done by kids. Like, even if you want to send somebody to the market, to the stuff, you just keep sending the kids like they are
they're on a holiday.
Slave. Exactly. So I think now is not the time. Now is the time to help them do their homework. Now is the time to encourage them to do their homework. Now is the time to encourage them to reach media houses in the Gambia who are giving them online lectures or online education right now. So I think it is important as adults, as parents, not just parents, but as a brother, as a sister, to these kids. Now is the time to help them, because they are the people who suffer the most during this lockdown, because kids are used to so many things, used to meeting their friends. And then now that they are not seeing their friends, this could have a negative impact on them. They were used to having activities that they are not having now. And then now is the time to help them cope better with this coronavirus. But I think the Ministry of Health or the Ministry of Basic and Secondary Education in collaboration with media houses, are doing an amazing job, making sure that at least there's something or some form of education that is reminding these kids of what they should be doing at home. So it is now the responsibility of parents and brothers and sisters who are in the households to help these kids provide the environment they need to learn during this period.
Yeah, I think that's a very vital point. We need to find. I think to put it in the context, we need to find the right balance. So, so whether parents or siblings, who are elderly, older siblings, it's important to know that, even this time that kids are at home, put it at the back of your mind that they are at school. Take it as they are at school, because if you do not put them into that situation, they will fall behind when school reopens. They will fall behind, and as a society, this can have impact on us when we look at it in years to come. And then it might impact the results that might come up in the next 2 years or the next 3 years, even maybe the next year. For those who are going to sit their grade 9 or grade 12 exams or something like, even grade 6 exams, it is important that we support kids as well.
And then Dawda, not just parenting. This point talk about the family, and I think I don't think this is a big problem in the Gambia, even though maybe I am not privy to the research that have been done in the Gambia, but then research elsewhere globally have shown that domestic violence have increased during this lockdown period. That is, these people or domestic abuses and all that, they have increased. So we're going to encourage people, especially couples, to be more understanding during this period, not just for their sake, but for the sake of the kids. You could not just be quarreling all the time in front of these kids, which is going to have a very serious and a significant negative impact on them. So
yeah, I think that was fitting into our like healthy mind or mental health status, whereby we have to be with each other as well. As you mentioned, quarreling with someone else, like with your husband or your wife, can mean that if the kid is there, it can have some mental trauma on the kids. If that kid needs to go and study, it can affect them as well if there is no stability at home. So it's like a ripple effect, that can have that can come back to the to the kids at the end of the day. So we just need to put it at the back of our mind that every sacrifice that we are doing today, we are doing it for the sake of our children who are yet to come, or who are there, on the line. So it is important when we have these things at the back of our minds, we will be able to choose the right way to go on about it.
Yeah. So I think, Dawda, it's been so far very interesting, some of the points that we've discussed, and I think if people could follow some of the things that we mentioned here, we might, of course, forget about some key points. And I think the people who are watching this program can just comment on the comment section below and tell us some of the ways in which they've been staying physically fit, and how they have been staying mentally stable during this period, and how they have been also conducting this healthy parenting. And if any of them also have tried to quit cigarette during this pandemic period, we would like to know. Please tell us during the comment or below the comment section of this program. So Dawda, I think we are not very far from the end of this discussion.
That's right.
But now we will just talk about food, because we the fullers, we love food. So
I love cooking. So let's talk about food.
Let's talk about food, because I've been seeing you, Dawda. I think you are now a chef. You've been posting some amazing things on Facebook, and then I think you tried pancake the other time. So
I did. I mean, cooking.
So what should we be eating during this pandemic period?
I think first things first, what we need is to understand that what we eat is what we are. We are what we eat. And then this can affect our body's ability to prevent, to fight, and also to recover from illnesses as well. It is also very important to let people know that food is not it's not like a cure. It's not going to prevent or stop you from having the illness, but it will help you if you have the right immunity or the right body frame as well to be able to fight the disease. This is something that people need to understand at this point. The next thing is about I like to talk about portion. It's very important when it comes to portions. You know, it's easier to tell people, let's eat fruits and vegetables and all those things, you know, which it should be right. You know, we should be able to grow these things for ourselves. We should be able to have plenty of fruits and vegetables in Gambia. So we shouldn't be saying like that's expensive and expensive. We should be able to do that. That is fine. But we focus so much on our staple diet, which is rice, oil, and onion. This is what we know. Even look at the Gambia now. Like, what are the gifts that people are giving? You know, rice, onion, oil.
Finish and oil,
Yeah. That's what they give. And
if
you look at rice,
it's carbohydrate.
Yeah, it's a carbohydrate. It's not carbohydrate are not bad. You need it for energy. You need it to be stored as fat that can be turned into energy at a later future, right? But if you look at the portions, the amount of portion that we have in, you know, like for example, when you say what is a portion of rice, it is a small cup. But myself, when you talk about my portion of rice, it's a bowl full of rice, you know. So our body can only consume a certain amount at a period of time, you know. The rest will have to be stored as fat, you know, because the body wants to reserve it for a later use for a rainy day. That's what the body wants. It's survival. So if you keep storing it and the body is not needing it, at the end of the day, that fat has to accumulate somewhere. And as we see, most likely in Gambia, people tend to put fat around their abdominal area. And research shows that those who put up fat around their abdominal area are more susceptible to diabetes and hypertension, because the fat is covering your internal organs.
And compressing on them.
Yeah. So even though you might see somebody who doesn't have a big body mass index, you know, or class as obese or some other thing, but their circumference might be too much because the fat accumulated up there, and this can increase the chance of having diabetes as well. You know, so I think it's very important for us to think about that. You know?
So basically what you are saying is people should eat healthy, and eating healthy means eating a balanced diet. Unfortunately, only maybe 2 out of 10 Gambians eat a balanced diet, you know. So like you were saying, we should be increasing the eating of tomatoes, the eating of carrot, cucumber, all these green leafy vegetables. They are very important, not just the rice and the oil and the onion. Like we see people are donating, although they are doing a wonderful job, because that is a stable food in Gambia. Like if you have oil, you have onions, you have rice, then you have food in Gambia. But then I think we need to think of how to blend in other vegetables as well, because veggies are very important.
It is. And you don't have to fry it. Not everything is fried, you know. So not everyone, you don't always have to have, you know, oil, you know, to cook. If I may, for example, Flus don't use a lot of oil before. I don't know Flus nowadays, you know.
No, we don't use. No. This is why we always like this hakapute and all these green leafy vegetables. We really like them.
Exactly. The hakapute doesn't have a lot of oil in it, you know. And you look at a lot of those diets, you know, like they boil, you know, you boil it, you know, and all those things. Or you can steam, you can boil, you know, and all those things. Not a lot of people have the ability to roast, but, you know, there are other ways that you can cook as well. And then you will have the right flavor in it. And then we just need to be careful about our salt intake. When we say salt, it's not only our raw salt that we put on food, but exactly all these safal that are coming from Senegal. I'm sorry, I have to mention it. You know, they are killers. The amount of salt content is very high. It is very high. So I think it's very important for people to understand the amount of salt they put in. You don't know this until when you move away from eating that amount of salt. For example, now, like the sugar and salt, you know, I'm saying this because I've been away for a while. When I go home and they cook, now it's reduced, but at the beginning when they cook, I find it very salty. It is too much salt in it. Or when they make other sweetie stuff, it's too much sugar in it. But that's what I used to eat before. You know, but because I've cut it down, now the moment I eat it, it tastes very salty, because my body does not realize that I don't need that amount of salt in order to.
You don't need it, because if it's also nice. It's too much salt is putting you at risk of developing cardiovascular problems and illnesses as well. So yeah.
And to put that into context so that people can understand it in a more scientific way, because if you say salt, people do not understand. What salt does is salt attracts water towards it. It is in the form of like sodium or something, like, you know, so which means that the amount of water that you are retaining in your body or in your blood vessels will increase. And that increase your blood volume. That increases your cardiac output, and this increases you, and with your stroke volume, and then what? Blood pressure increases.
Yeah.
Then what do you have? You have high blood pressure.
Blood pressure, yeah, because of too much salt intake.
Exactly. In terms of oil, how does it work? The fat deposits inside your bloodstream at the end of the day. Like some of the oil in Gambia, if you need to put oil under the sun for you to be able to cook it or eat it, that oil should not be consumed.
Yeah, this is we even have a joke for it. Some of my friends in the Gambia, we used to say that there are some oils in the Gambia, you would have to wake them up. If you don't wake them up, they will not, you know, like the funga island. So then so this kind of oil is really not good, where you would have to put them under the sun for a while for you to be able to cook it. It doesn't even make sense.
It doesn't, because if you look at it in this context here, the temperature in Gambia is higher than our blood temperature. You know, our blood temperature, you know, we know that, you know, blood carries most of the heat in our body. Our body temperature is like 36 to 37 degrees. Yeah. So, and sometimes Gambian temperature, even at 36 degrees, this oil will still be like sticky. They will not melt. So what you can think about is that that's how it's going to look like in your blood vessels. You know, it's going to sediment somewhere, and it's going to narrow the lumen, and this will increase the blood pressure. You know, so giving you hypertension, and later on we can lead to other disease.
Thank you, Dawda. You're absolutely right. And then considering the aging population that we are also having, people who are elderly are more at risk at some of all these things that we are mentioning right now. Eating these kinds of foods, these kinds of oils, is putting them more at risk of developing a condition that they are already at risk to because of their age. So I think the other factor is providing, or like the Sarahules would really like to probably cook too much food, you know, for after they cannot eat it all and they want to store it. So I think it is also important to talk about how to save or how to preserve this food properly, not to be infected or not to, you know, have food poisoning from these foods. Especially now it is Ramadan, we understand a lot of people provide or cook a lot of food that probably they could not consume and would like to probably give it to the kids the next day, or sumbalol, as the Mandinka food called them. So
I know, you know, because I know even us, you know, Jahankas, you know, we like our food. Sometimes, you know, we can get pisalo, you know, pisale sometimes in tomorrow or tabi. So, but we need to understand that, you know, food wastage is not good, not only in terms of our religious aspect and then thinking about other people who are hungry because they all, you know, all those things, who doesn't have the food. But at the same time, you know, you can only cook what you can eat, you know, and in that way, you know, you don't have to worry about preserving it, you know, especially if you are not fortunate or if you don't have access to freeze it or to put it in an ambient temperature.
Which is really a big problem in the Gambia, considering the NAWEC situation, considering that not many people have this very good freezers. So it's always a problem. So I would advise them to cook portions that they can eat for a day, and then make sure that they are eating fresh and they are eating healthy. So I think, Dawda, this was really an interesting program, and it was really nice
also, to have. Yeah, I think what I just wanted to say is water, because we haven't touched base on that. You know.
Yeah.
It's good to see you drinking. I have my glass of water here because my mouth is getting dry. But you know what is very important is they always say if you're feeling thirsty, you're already dehydrated. You know, so you should be drinking. Especially in Gambia, every individual, you know, and other person should be drinking at least 2 liters of water. You know, to put it in the context, this is like 8 glasses of water. You know.
Yeah, I think that's even little.
It is very little. That's because of the humidity and the heat in Gambia. You need more than that.
Yeah. You need almost 5 liters a day.
this is like a minimum, because how does water help you? You know, a large amount of our body content is made of water, you know. So, and also when we relate this to COVID-19, it is how to understand is that, you know, this water, you know, trying to help us with our, you know, the cellulars, like our secretions and all those things, you know. So it's like, which helps in flushing down anything that comes in there.
There's even I've read a publication that was made about COVID-19 and how it stays almost for 3 days, you know, in your throat, and when you drink a lot of water, there's a possibility of flushing it. So these are all things that have been researched on, and I think not just the flushing part of the COVID-19 staying on your throat and all that, but then water in itself is important because it forms almost 80% of our body.
It is, because and your organs need to function with water. If you don't have enough water, your organs are not going to function properly, which means that they will not stand a fighting chance.
So stay hydrated. When you stay hydrated, you have a healthy skin, and your organs function well, and everything is okay.
Good. I think we've covered a lot of points. You know.
So just to encourage the people to comment, like we said, they could be sending us their comments and things they think we should be discussing during this lockdown period, and we will try and bring them, you know, videos on those topics that they feel are very important and that they need to learn about. But also, we will try in as much as we could to do the same program probably on the local languages for people who may not understand the English language. So we will also try to, you know, dwell into the local languages probably in another or in a subsequent program that we will be bringing you. So it's the Health Stars Foundation or it's the Health Stars Gambia. We'll be bringing you videos from now on about the coronavirus and how to stay healthy. And
if anyone has a suggestion down there, you know, please make a comment down below and tell us, you know, what you think or how you think we can improve the situation to help each other and remind each other. It's not about trying to spoon feed you, but, you know, or to overload you with information, but it's just to give you some bite-sized information so that we just remind each other. We know that we are here for each other as well. So, you know, I think to round it up, you know, today we spoke about, you know, a good deal of things like, you know, staying physically active, looking after our mental health, quitting tobacco, you know, healthy parenting and eating healthy as well. And just a touch base on that, I just want to speak and talk about breastfeeding. If you are breastfeeding at this point of time, you know, it is very important that you carry on. Your baby needs that milk. It's very important. Look after yourself, look after your baby, and then feed your baby in the right way. You know, inshallah, it's all gonna get better. And Health Star is here for your questions. If we cannot answer it, we will try and find out for you, and we'll push you to the right direction.
So thank you very much, Dawda. It was really amazing to have you on this show as a co-host.
Thank you very much, Ebrima, and then I will see you soon.